the hell out of me. I've had it for six plus years, and I'm still not been in a sustained remission. So we decided that we were going to go and do a clinical trial. We did it up at Penn, University of Pennsylvania
Right.
Hospital.
And what year was that?
That was in, let's see, about 2018-ish.
Okay. And what was the name of that clinical trial? Do you remember?
So the first one was a drug called teclistamab.
Okay.
It's now on the market as Tech Valley.
Okay.
And it was, so we had two choices. One was a CAR T cell treatment, and
Mhm.
one was a bispecific antibody.
Okay.
Now, I don't think it's the same now, but back then, if you did a CAR T and it didn't work, you were no longer eligible to go on a bispecific antibody.
Okay.
But if you did the bispecific antibody and it didn't work, you could still do a CAR T. So it was really a no-brainer decision in which we chose.
Right. Right. And so when you did the teclistamab, how did that go for you? How was that process?
Um, so if I said it was miraculous, it would probably be a little bit of an understatement. Um, so I'm in the hospital, hospitalized. I think it was for the first 10 days. And doctor comes in and says, "Hey, listen, there are two arms to the study at that time, one through my port and one a sub-Q." They said, "Okay, you were chosen for the sub-Q, and this dosage is 1/25th of a full dose. We just want to make sure, nothing really negative happens, just a kind of a test." And they said, some people still respond, and we're hoping within a few weeks, maybe a month or so, we might see some response. A couple of hours later, the pain started. I mean, I, I mean, just unbearable. I'm not a big cursor or anything, but my wife was like, "You were kneeling on that bed, screaming like
Mm,
a scream, or cursing like a drunken sailor.
wow.
You were screaming that it felt like someone was shoving a hot metal bar down your spine." And thank God I didn't remember any of this.
Hmm.
So, 48 hours after that first test, they do blood work to follow
Sure.
up.
Hmm.
And I was still in pain, but my phone rings in the hospital room, and my wife picks it up. And she's talking, and she goes, "Hold on, doctor." And she goes to put the phone up to my ear, and I'm thinking, what's the matter? You see me screaming. And she saw this stress on my face, and she said, "Mike, all you have to do is listen for 10 seconds. You don't even have to talk." I said, "All right." He says, "Mike, this is Dr. Cohen. Um, we've never seen results like this before. Um, in 48 hours on that super low dose, my cancer dropped by over 99%. And that's what the pain was, this cytokine release syndrome. And it was, a few hours after that, I was able to kind of think and all. And I remember looking over to my wife saying, "Did I have a dream about?" And she says, "Nope, wasn't a dream." And and that was all the pain I had. So at first I'm thinking, now it's going to be 5 times that dose. And if this was as much, not knowing a lot about cytokine release syndrome and all, I said to Angela, I don't know if I could do it. And I had the next one and nothing because there was no cancer to kill in me. And then I had the 5-time dose and there was absolutely nothing. So I went back, it was a weekly treatment, and I went back once a week for 18 months. And after 18 months, as myeloma does, it mutates and it came back. So they said, "Hey, listen, you could do a CAR T again, or you could do a CAR T this time, or, there's different antigens or proteins on the cancer cell. There's another one out. that's getting really good results, another bispecific antibody. Would you want to try that? And I'm like, yeah, if it's the same kind. And so I go in, and this one was called Cevostamab. It was a
Okay.
Genentech one. The first one, I'm sorry, was a Johnson and Johnson, or Janssen's as they were called back then.
Right.
Um, so I went in, they did, I was hospitalized. I think it was 4 days, 1 week, 4 days, another. I'm not positive about the timing. And um, pain was severe, but nothing like the first time. And 2 weeks after my first dose, the cancer was undetectable. And but it gets better for this one, right? So this one was one treatment every 3 weeks, 17 treatments is a year, and then they stop it to check durability. And I remember people saying when they were about to stop it, I remember people saying, "You've been on cancer treatment for over a decade nonstop. You must have been ecstatic." And I was like, ecstatic? I was like, what do you mean you're stopping cancer treatment? No, wait, no. This is why I'm here. This is why I'm alive. If you don't have any more of this, you can't give me something different. And certainly I got used to it after that, but they stopped the treatment after the 17th, after a year, to check durability.
Mhm.
Um, the 22nd of this month will be 2 years that I've not been on any myeloma treatments, and my cancer is still in complete remission.
So they
So
stopped it. You haven't had to go back at all.
not yet. Nope, nope. And
Wow.
it may or may not happen, but like my wife always reminded me, Mike, every 2, 3, 4 months, they come out not just with another drug, but another classification of drug, right? It's not, in the past, it was, this didn't work, let's give him stronger chemo. I mean, I'm sure
Right.
you've heard the saying, people don't die from the cancer, they die from the treatments. And, here I am today, still in complete remission. And, I go for a checkup in 2 weeks again. So we'll see what happens there. But as you can imagine, I couldn't be more pleased.
That's Mike, you gave me chills. Honestly, that's an incredible story. So thank you for
Thank you.
sharing that.